All right. Well, I think we can go ahead and get started. Just to start this off, if you're new to this office hour, welcome. My name is Alex Dietz. I'm the Medicaid Program Specialist with Oregon Primary Care Association. And just a little bit about me, my position is grant funded through Kaiser Permanente. Um, and the function of my position is to engage with FQHCs and sister networks to help provide access to health insurance options through the redetermination process. And I started this role in beginning of October, so a little late in the process of the whole unwinding. And I've been trying to quickly catch up and make connections and get to where all of the work that you've been doing, where I am understanding and can provide a lot more service to you. So um, just a little bit about this office hour. Sorry, I'm getting a little ahead of myself. I wanted to mention that prior to my role with OPCA, I was working as part of a mobile crisis outreach team, so assisting folks out in the community with various uh, help like community-based services. So some of this work is new to me, and a lot of it is familiar, but yeah, I'm excited to be doing this alongside all of you. And about this office hour, this slot of the 1 to 2 p.m. Has been a monthly meeting that OPCA has been hosting. If you've been coming to this for a while, you've probably seen a rotating cast of hosts, and I took this over in October. And right about that time, we noticed that James and his team over at ODHS was hosting a meeting right after ours. So we were thinking that maybe it would be a little bit easier if we combined forces and created a partnerships that maybe could uh, create a little bit more robust information for everybody in one place, and maybe bringing in the people who are attending that meeting and our meeting, and maybe have a little bit larger conversation. So that's kind of where we're at today. And this is only our second time partnering. So maybe still working out a few kinks, but we're getting there. And the goal of this space is really just to provide up-to-date information regarding the Medicaid unwinding renewal process, and to offer a space where you all can come together and ask questions, maybe share stories that might be helpful between everyone. And then, just really kind of get a better understanding where everybody is in this process. And you're welcome to ask questions throughout. Mostly we're going to be waiting till the end to answer those questions. If it makes sense to answer in real time, that might happen. But generally speaking, we're going to wait till the end to address all those questions. And we are keeping track of what questions you might be answering or asking. So if you want to switch to the next slide with our agenda. Thank you. So yeah, we just did the introductions, and we're going to move on to our presentation. And that presentation is going to have a couple of speakers who are going to give renewal updates, some dashboard updates, and then it's going to be a majority this time of just a question and answer time. A little bit more time for, there's a lot of people in this room that might be able to answer some questions you've been having. So giving a lot of space for that. And then we're going to go over a little bit of just options for giving feedback, maybe a little bit of like if anybody has any resources to share or events coming up, that would be a good time to do that. So I think we're going to just get started. I'm not sure who's presenting on our speakers today, or introducing our speakers today, but I'm going to hand it over to one of the ODHS team members to do so. So thank you.
Sean, I think I'm going to ask you to go ahead and take it away.
Hi, if I haven't met me before, my name is Sean McAnulty. I'm the OHP Member Communications Coordinator and the co-lead for the Pandemic Unwinding Communications for the Oregon Health Authority. So we've got some slides here that you'll have probably seen some version of before that are how we're progressing through the redeterminations timeline. We are in the 10th month, at least out of the normal initially scheduled plan. So that was going to be the final month of outgoing pandemic renewals, and then we would have 4 more months of wrap up here. You see on the right side of this, those phase 3 renewals have been spread out throughout the entire population, but you're going to see a little bit more of them these final months. Though that initial plan, if we can go to the next slide, has been thrown into some question. We are currently awaiting a update from CMS and approval of the updated timeline. There are about 110,000 renewals that were not started in January that are no longer currently appearing in the pandemic dashboard. That is a temporary thing while we figure out the new data presentation. There have been some additional updates made to the dashboard, but those additional 110,000 are not currently displaying in there. That was about 7.6% of the total population that was going through renewals. All of the other ones, though, that besides that 110,000 have now been initiated. That means that they're currently going through the automated renewal process. They're being sent over the next week or two. But the vast majority of people, that 93% or whatnot, have come up for renewal as of this month, except for that 110,000 we are eagerly awaiting being able to provide more information about as soon as we get that timeline approval from the feds. So we'll keep providing data about those, but there's more to come soon there. This slide here describes our outcomes as we go through the renewal process. I do want to caveat that the 79% number here does include that the 7% have dropped out, so that's somewhat, that caveat applies to that data. But we're about 80% of the way through the renewal process, with 85% of people who have completed their renewals keeping benefits so far. That is the people who go through the process in any form or fashion. That includes the responses on this one. For the benefit reduction category, that is mostly people that had OHP and then continued another program, for instance, a Medicare savings program or Veterans Dental, something where they had a previous benefit and then downgraded a step to one of those other types. That is only 1.7% of people getting that outcome right now. Then there's another 13.3% that actually have their benefits end and need to find other coverage. So these people are going to be heading to the marketplace, employer coverage, or Medicare options as their next. Oh, and to Melody's comment in the chat, yes, I do have the incorrect year on that. That is a 2024 data point. Thank you for catching that. So 13.3% of people benefits ending is where we are at the moment. We go to the next slide. One thing we do want to call out is that since the benefit restorations that occurred after some renewal issues earlier this year, we have seen that benefit reduction category drop quite significantly, down from 3.2 to 1.7%. As some people go back through the renewal process, once those additional, that's the 110,000 people I was talking about that are coming up later in the process that we don't know the exact timeline for, that as some of those people go back through the renewal, we would expect some of them to lose coverage again and that number to eventually rise. So this is looking good right now for us, and we might see the renewal rates rise going forward. We can go to the next slide. This next one's going to describe what we asked them to do during the process, not the final outcome of this. So as people go through renewal, the first thing we try to do is automatically renew the case based on information they have on file. We'll verify that against federal data sources. For 66% of people, 2/3, we have been able to renew them without having to ask any response from them. So they just get to keep their benefits ongoing. They get their new, in most cases, 2 years of continuous eligibility, and just get a new letter saying that they've been renewed. For about 20% of people, they actually have to submit a request for information, that is pay stubs or an ID card or some other form of information that we need to be able to complete their renewal. 7.5% of people are getting the full renewal packet. That's just pretty similar to what you first signed up when you filled out when you first signed up for OHP, either in the one system or the paper packet. And then 5% of people get an automated closure. That means they've previously told us that they're over income or no longer eligible, and we just close them with a 60-day closure notice window rather than having to require a response in that instance. I also want to again caveat that this 100% of renewals started by January is just the ones that are currently showing in the dashboard. It's kind of 93% of the total population has come up for renewal by January, but it's the final normal month. It was a larger one. The majority of people have gone through that process now, so we're approaching the end, but still have a longer tail to come. You can go to the next slide. When we put this on national comparisons, Kaiser Family Foundation that's the former name for them, but KFF, the former Kaiser Family Foundation, is a health policy nonprofit that compares state-by-state re-enrollment rates and whatnot. When we look at our renewal rate, Oregon's currently in second place for the highest renewal rate of any state besides Maine. We see in some states, like Texas has got 62% of people ending compared to 13% in Oregon. We're really having a markedly different experience than any other state or many other states due to all the steps Oregon has taken to preserve coverage for folks. If we go to the next slide. For the overall decline in Medicaid population, which does allow for new people having signed up in the meantime, we've expanded coverage through Healthier Oregon and other programs over the last years. Oregon has actually had the least drop of Medicaid population overall of any state in the nation. So in that regard, we're doing best. Another lens that we're doing really well on is that automated renewal process I was talking about earlier. By using that more heavily than any other state, if we can go to the next slide, by using that process much more heavily than any other state, we have prevented people from having to respond unnecessarily more than any other state in the country. So we have made the renewal process easier for folks in that way as well. We're taking a look at various ways to continue improving these process, looking at the demographic disparities and whatnot, but we did want to really celebrate that we are making this process easier for folks for a variety of ways. David, you got your hand up here.
I do, Sean, and forgive me, I don't mean to pour water on things, but I just want to also with this slide, I presented this slide a couple of times, and I really just want to also acknowledge that, you know, we are doing well in this comparison for unnecessary paperwork. That doesn't mean that members are are experiencing a lot of paperwork. There are a lot of programs that they may receive, you know, paperwork from the state, and it may be about SNAP, it may be about medical, it may be about all kinds of different things. So if you read this and you go, I've heard from members and they still get a lot of paperwork, I think that what we're really trying to say here is that that's still very much could be true, and we have big opportunities to keep improving there. But as far as minimizing paperwork for medical passive renewals, we are ranking pretty low. So I just wanted to kind of tweak that a little bit, and as I've done that in a few other meetings this week. Thanks, Sean. I appreciate letting me butt in.
Absolutely. And then I think at the end of this section of slides, we can go to the next one. I think I already talked about these points. Yeah. Okay. And then I think, unless we're out of content, we're into Q&A section, it sounds like.
Yeah, thank you so much, Sean. We do have a few questions in the chat already going. I have one from Melody, and it's about the current backlogs and how backlogs are being addressed, and some questions about vendor supports. Melody, if you want to chime in and add anything to your question, feel free.
Yes, we were just looking, as you know, we at Legacy Health have a high population of Medicaid in our hospitals. And so now with the information about the 100,000 renewals, to make sure I'm understanding, not in the dashboard and don't know why, will that be what I can bring forward? Is that's kind of now going to be the backlog? Or is it just you've already done the work and somehow it's just not listed in the dashboard appropriately?
They're just not falling in the dashboard right now during this, interim while we don't have approval from CMS. David?
Yeah, I just want Melody, that 110,000 that we're waiting for CMS green light to redistribute for redetermination. The reason why they're not pulling up in the dashboard right now is really more of a mathematical issue and a date range issue. Is that we had set the date range for this 14-month period of PHEU unwinding. And since we've now removed those people from that 14-month window, they're showing as not existing in that dashboard. So what we're working on right now is just expanding that timeline window, and that will recapture those folks. I think that you know, the rest of the data remains sound. So I would not want you to go back to your folks and say that the backlog is 110,000, because that would not be true. Those folks are still just waiting in line to start their redetermination process. And to me, a backlog states that we have work that we haven't touched yet that we've received. So I really want to make sure that we're parsing that difference a little bit. Now, we should have, by the next office hours here, we should have an update about either the dashboard will be fixed, and or we'll have a timeline or an update around that issue that we've self-created by extending the amount of time that we're giving these folks to renew.
Okay, so is there, just so for my, VPs and all the folks that are asking, is there a current backlog, meaning you have a list of what you need to renew this month, or let's just say a list that you, the volume that you have for December, that you want it to be completed in December, and it's not, so therefore it's carrying over to January as quote unquote backlog. Is there any of that information you're able to share?
I did get one response back. It's not quite fully answering your question, timelines or anything. There was a stat that 90 to 97% of like things that are being renewals that are being submitted, tasks that are pending and whatnot are being processed before the benefits end. So there's little in the way of backlog there. I don't have the exact timeline data point that you were looking for, but I was given permission to share that point of
And
95 to
I know
97%
Melody,
time.
sorry, Sean, I didn't mean to talk over the last part there.
95 to 97% of the time we're getting it done by the deadline. There's what was shared with me there. David, if you want to continue.
Yeah, sorry. And once we've got the dashboard issue fixed, you should be able to toggle and look at the current workload again in with a little bit more accuracy, and then be able to report that to whomever you need to.
Okay. And then last question is, are you already currently using a vendor to support the work, or are you, I'm just kind of getting an idea of, that you use the vendor already and that's why it's so low, or you already doing overtime and that's why it's so low, just to give that.
Yeah, I think there's multiple things, Melody, that can contribute to it. I don't know that I will say that it's so low. I would say that, and I'm not trying to disparage our friends at ODHS, but there is plenty of work, and it's not like it's same day next day. I think that they've got a lot of work that they're trying to prioritize and sure that they're up to date on by federal rules and state rules to make sure that they're processing within that kind of window of time. So a couple of things have happened during the public health emergency to kind of help them get more capacity in their customer service center. First off, 3 years ago, they asked for several hundred more eligibility workers to the state legislators, and they denied them that. So that was the first thing that we attempted to do. The next is that we were given permission and dollars to pursue a vendor to help that some of the customer service increase that was expected. Done that with a group called PH Tech. They have been contracted for about 18 months now to help on the phones primarily. They are a group of about 240 that answer all of the phones. They answer the phones before an eligibility worker does. So they do a lot of initial call triage. The hope is that group and that group's current wait time is usually around 30 seconds. So they're able to answer the calls quickly, see what the member needs, see if they can resolve that issue with the member without needing eligibility intervention, or refer them to other resources. If not, then they pass that call on to eligibility. Now that we're able to resolve about 30 to 40% of the calls per day in that method, and we're able to prevent those calls from unnecessarily needing an eligibility worker intervention, and also giving a little bit more capacity to ODHS to be able to keep working on those high priority tasks. So that's been in effect since I think I'm gonna mess up my years here, but I think I'm gonna say June 2022 we started doing that. And then for all of 2023 and for all of 2024, we will have several hundred people helping help keep the phones clear as much as possible. Now, there has not been any other vendor support on the eligibility side, and most of that is prohibitive because of how long it takes to train and become efficient as an eligibility worker. That's why we kind of tried to do this kind of customer service triage option based on legislative support and kind of what we hired. So that's some of the reasons why they're able to kind of keep going. I will say, the 110,000 that we're moving to the summer doesn't hurt. because that's further spreading that work out a bit. And moving that work out to the summer allows them to have a little bit lighter of a workload now. I will say that's helpful now, but also we're gonna have to pay the price for that at some point, and make sure that we have the ODHS has enough support to keep working through all of that. But for that's also at least a contributor to why we have slightly less workload, because we have delayed 110,000 additional folks until after we can resolve these system issues.
And then Sean, I see your hand is raised.
Yeah, just a couple of things I wanted to add for that. It was other thing that's going to be happening as we return to this other months is that regular non-pandemic renewals will return in some numbers as well. But particularly exciting for this group for call center team changes is that in March 2024, at least it's still targeted as that date, could be subject to changes to the state, but the return of the dedicated team handling assister calls is currently scheduled for March. So that will be very exciting for this group. I know many people have expressed feedback around that and Spanish access and whatnot on the CP assister line specifically. So that is another change that's directly going to affect y'all's work. Also just wanted to mention that we've got some reports of poor sound quality over the last week or so. So if you have feedback about sound quality on the line, we are currently looking for that to try to address and respond to that if you're having any issues like that. So taking the opportunity to mention that too.
Yeah, and we're gonna show the feedback form at the end of this session. So anything like that, we'll try to connect you. And also, you kind of spoke to this a little bit, Sean, but I know that there was some problems with some calls getting dropped, like people will wait through this process and then a call will get dropped. I'm not sure if I'm correct in like maybe that's happening when they get transferred from the triage system into the eligibility, or if that's happening later. But I know that there was some concerns around that. I don't know if anyone has anything to speak to. Maybe that's a larger concern that they're hearing. Maybe not. Just throwing that into the ether, but also there is a question in the chat from Vicky. I'm just going to read it off. Vicky, if you want to chime in, you're welcome to. It says, and I believe this is about the auto renewal system. So people that are renewed without action, I think that's the 66%. Is that because the one system is just taking the action based on the previous information we had in the system, or is there someone reaching out to clients to confirm there's no changes?
So that is done, I'll say systematically, but I also want to say that that's like not just pulling data from 3 years ago. The one system is teed up and connected to many data interface systems. Some are federally controlled, and some are state controlled, and so it looks at a lot of different data sources, and then the system says, are these data sources considered current and sound enough for us to make this decision? If the computer says yes, then it just sends that passive renewal saying you're going to continue receiving, or you're not going to continue. And some of that's based on like tax returns, lots of different kinds of pieces of information. And then the system is also capable of looking at that information to say, you know what? We don't have enough information, or we don't feel as confident about this information based on the information that we're pulling from. So we're going to ask for more. So it kind of has an ability to do that. I will say that it's something that we're always kind of tweaking and making sure we're looking for improvements to get better at. When we send that information we're also reminding the members though to keep reporting and updating their personal information. So if their income level changes or their household changes or any of those kinds of things that might affect that eligibility, we're having that on file.
David, is it safe to say that, if someone has done a SNAP renewal, then in the last 2 years, that's where a lot of that information is coming from?
Absolutely. That's definitely one of the data correlation points. If they've updated their income via SNAP in the last 6 months, the system will, and I should say, don't quote me on 6 months. I don't know quite what the window is, but there's a window of acceptability, right? Where if they've recently updated their income via SNAP, they're going to say, oh, that's the right amount of income for OHP. We don't even need to do any work. We're just going to move on with we're just going to send them a notice and let them know that they can carry on.
I will
So
just note on SNAP that the SNAP income in the one system is generally going to be the same income treated as like the main income on their case listed. That's the same. You'd update the same for both in general. So sometimes there could be processes where you could go through in that, but that's going to be a particular one where that's the main thing we are verifying is if they've reported that change and whatnot. But in state employment department data, there's many other places that we get that from too.
And then this has been a lot of information, I'm sure, for folks. Is everyone feeling like you understand, you know, what we talked about in the presentation? Does anybody need any more clarifications on some of what we talked about before moving into a new topic? Just going to give a minute, see if anybody has any last thoughts based on that presentation. I actually have a question. You know, when we're looking at those national rates, I know that the way that we've done our renewal system, we sort of front loaded like the easier cases and spread out the more complicated cases over time. Do you think that that's going to shift at all as we sort of go into, you know, the later phases of this process? Is that something that's just like, you know, I know that we have some great, you know, we have like our continuous eligibility. There's a lot of like the ways that we've handled this is like, you know, reflected in that national number. But I'm wondering as like we get to the tail end, if there's going to be any sort of things that like people need to be looking out for. Because I don't want to give people like this like rosy picture and then have something like pop up towards the end here. So yeah, David, that would be great.
yeah, I really appreciate, and I can't remember your name. You're listed as just OPCA policy
oops.
team right now. But
Oops,
I
I
really
forgot to
appreciate,
change that.
I really
This is
appreciate
Alex.
that point. Thank you, thank you. I really appreciate that point because measured celebration is really kind of what I'm trying to think about a lot. And like some things have gone really well, but also some things have not gone well. Like the OSIPM population that have their benefits disrupted and then restored. That is the and no population needs to be disrupted, but oh my gosh, if I could, if I wish it hadn't happened to that group so badly. You know, so like I think there's still possibility for pitfall. Plus, if you think about that population that we are now, you know, attempting to line up a late spring and summer redetermination process, to me, that almost gives us an opportunity to get really focused on how to help those people even more. Because so one of the things I wanted to kind of dovetail into that is that we're going to spend some time over the next 3 months talking about if we're going to have that population be set aside for those 3 or 4 months, what can we do to help them and make it as easy as possible for them to add more support wherever we can? And that's going to be a group conversation. And it seems like something we can definitely have here. But that because I don't want to celebrate too soon. And there also is a very real chance that something might get goofed up again, or that the reality of the populations in the summer that need to be redetermined, some of those people might legitimately be transitioning away from OHP, and they're going to need help finding what that next step. If they legitimately are no longer eligible, you know, that's where our marketplace team and some of the other teams are really going to need to be there to catch them, to help them understand what the next step is. That could be after this many years, very scary and stressful for those folks. So I'm really kind of like doing a lot of hesitant, saying things are going pretty well, but we have a lot of people who still need our help in the back.
Thanks, David.
Other thing I think we can say at this point about those other groups is that the ex parte population, the way that was for people who there was one member of the family that could have passed the automated renewal process, one that couldn't. That means that it is a household. So it's going to be some more than one person in that family. There's going to be some demographics that results in that population having that others don't. Same for the OSIPM population, is overwhelmingly people who are over 65 on disability programs like supplementary security income, things like that. It's going to have its own specific demographics as well. We are requesting analysis of that. That way we can share it with you all as well and tune our outreach. And since we do so much of our work through partner networks like yourselves, sharing that with everyone is very important. We intend to be doing that.
Yeah, and then my next question kind of leads into this. Is just there's a lot more people who are attending our meetings, and I think we're coming from a lot of different places. So I kind of wanted to just get a read of the room of just, maybe putting in the chat like a yes or a no. How like confident you feel with like understanding where we're at with this renewal process. So we're talking about we're in the like later stage of it. Right now we're dealing with the backlog, and right now we're dealing with some of these more complicated cases. I'm just wondering if people can, let me know if this is new information to you, or if this is something that you're already thinking about or your organization's already thinking about. You could just put, a yes or a no or a Y or an N into the chat.
And also just wanted to follow up on one more point about that OSIPM group. Since a lot of them may also have Medicare or things like that, there's a possibility where they're not necessarily heading to the marketplace. They're also trying to decide between their Medicare options. If they're, for instance, moving to coverage that only helps pay their Medicare costs, they don't have dental through OHP, they might want to look at other Medicare options that might provide that sort of thing. So that is one of the particular things that we're looking to support for that upcoming wave of folks, is that choice counseling between Medicare options.
You called her back.
Thanks, Sean.
Hi.
Is it?
I was trying to call you right back.
I think there's somebody who's off mute. I think Wendy, if you could go back on mute. Unless you have a question. I'm getting mostly yes, a few, or at least one who's saying this is new information. And the reason I'm asking this is really to just get an idea of, if this isn't new information for you and you are thinking about like where we're at in the moving into phase 3 of this process, is there anything that your organization or your health center is doing to kind of think about mitigation strategies or outreach strategies around this? And if you have like something you'd want to share in the chat around that, I think, for some of the people whom this might be new to your organization, that you haven't heard that we're moving into phase 3 and that, the information or that the cases people are working on might be a little bit more complicated coming up. I think it might be helpful if you have any, outreach strategies that you can share with the group. And yes, to Elizabeth, we can share the slides out. Because we're like co-facilitating this, I think we're still getting our figuring out how we want to like send out this information. I think that's gonna be next on our agenda, is making sure everybody gets the information out after these meetings. But yeah, we'll share a recording of the meeting and we'll share slides with you. David, I see your hand is raised.
I've got kind of I want to jump off of Sandy's comment when it's a good moment.
Sure, go for it.
Okay, great. Sandy, we were talking amongst us just we want to tap on that comment a little bit to say that that's something that we really are trying to focus on and use these extra months to try and focus and get a little more honed in on that. As an example, there's many things to get a little bit sharper about, but that's one that we're really trying to focus on, is how do we, because I agree that some of the existing resources, they're not used for whatever reason by those members in some of these areas. So what can we do differently that will make it easier for them to engage with the process? So I just wanted to make sure that you knew that. And that we already flagged it in our group, said, let's take note of that. That's a great one. So anyway, that's all. Thanks.
Great. And then I see Catherine has a question. Is the percentage of people who lose coverage because of a lack of response likely to increase over the next few months because the groups that will go through the renewal process are harder to reach?
I'm not sure that's the exact reason, but we do expect to see that number go up due to Oregon was the last state to start terminating people for non-response. We only started doing that at the beginning of October. And then the renewal issues for the people who got incorrect approval notices and things like that had a lot of more of those happening after December. So we do expect to see more terminations happening. The way we structured the renewals was we put the ones that were easier first and then put some other populations that were um, going to be eligible for things like OHP Bridge, the continuation of coverage until that new program launches, into the second group. The hardest ones we spread out across the entire thing. So I think it's more the us starting to terminate people for non-response in October is what we're going to start seeing driving that number up.
And because, part of that population might be, not stable housing or some of those difficult cases. I'm just wondering if any of the group is experiencing that of like, your populations are a little bit harder to reach right now because they don't have stable housing. If there's like any sort of outreach efforts we can start thinking about for working through that tricky process, because or if, the OHA and ODHS team have some like solutions, or I know that some of this might be like in that auto renewal process because of, income levels and that it might not be as big of a problem as I'm thinking about, but I do have some concerns. So yeah, David.
I just wanted to echo that a bit to say that if this group has some hot ideas, we are down to try them. Like, and if you are like, what always works for us, X, Y, or Z, like tell us and we want to go try it. And there is nothing off the table, at least as a suggestion or a request. I can't guarantee that we'll be able to mobilize and do, but if you were like, we are able to connect with our house list and mobile population when we do this and it works really well, man, I want to know. And we will try and work that out. Christine, I see your comment, for instance. So we are happy to share what we're going to try to do, but there is no guarantee that there is no assumption from us that everything we've done is like dipped in gold, flawless. We figured it out. And it's really important that this feels very bilateral, and that we are able to receive great ideas, because I know as a group we would love to find that ace. We would love to find that trick that we're not deploying and make sure that we do it, because a lot of people are asking us about these populations right now. And I don't want to be caught flat-footed when someone says, yeah, we had this great idea and OHA or ODHS just never picked it up. I really want to know anything that's along those lines.
Thanks, David. And where would be the best place to send people for those ideas? Would it be through that feedback channel that we're going to show a little bit later in the slides?
Always a good idea. My email is always open as well. I'm not a closed door by any means. So any of your account reps, any of your rocks are always a good source to say, hey, David was asking for hot ideas, and here's 6. They'll find me, for sure. So any of those channels, flagging that for me is great.
Well,
Also, just to build on that, there is still time for many people to restore their cases. The deadline for the people who came up in April to reopen their case without a new application via the 90-day reconsideration period passed 9 days ago for the very first renewals. So there's a long window to fix this for clients that didn't respond or something like that, and for our outreach as the state or partners to be able to have that effect and get people back onto benefits and continuing coverage. So we really want to continue getting that, even though we're almost done, we still have the ability to fix those long-term disparities we will end up seeing otherwise. So
And I don't want to move on too fast, but, oh, we have a question. Speaking of income concerns, there are some folks that got kicked off OHP because because their SSI increased. Cost of living adjustments does not make much impact with the cost of everything going up. Yeah. That's
Do we have a policy person who can respond to this? I believe there's a system logic where we temporarily disregard that until the new income comes into effect in March. Every year, the federal poverty levels update in March. There is system logic built to handle this, so I think we might want to have that case escalated if you're seeing someone that has happened to.
I don't see anyone on the call, Sean. We might have to do a follow-up on that. We're missing a couple of our policy folks today. I know they're in all-day meetings.
Yeah, and
Yeah,
we are tracking all of the questions that are coming up or all of the concerns. So if we don't address it this office hour, we will address it in our one next month. And on that point, I do have a little bit of a rundown of some of the questions that were asked in our last office session that I'm not sure if we answered fully, but I'm just gonna go through some of those questions just in case we didn't cover it for you. There was a question, will we expect to see and some of these might have been covered in this meeting. My apologies if this is redundant, but will we expect to see continuous eligibility reflected in dashboard in one at some point, or are we continuing to just have to refer to the notices? The answer to that was there are no plans to reflect that on the dashboard. It's just going to be through notices. And then also all the teams that are present, if I get any of this information wrong, please feel free to chime in. For the OSIPM restoration cases going until 3/31/2024, if they are still coded OVR-OVI, will they auto deny, or are they going to require renewals? And the answer that we have is that some may auto deny, but not across the board. More info about the OSIPM renewal process will be provided in January after the CMS provides approval. And if everything goes smoothly, income terminations is potentially or permanently changing in the April system update. And then,
Yep.
Oh, go
The
ahead.
April update is going to be a fairly significant shift in how some of our renewal pathways go. So we will provide more information as soon as we have those all set in stone and able to describe those with certainty before we make promises that tell people things will go otherwise. But that's going to be some really exciting changes in there.
Cool. And then we have a question. There were some Medicaid patients who were renewed in error, so had their coverage extended through the end of December 2023. This is something that we've been talking about in our office hours. Is this reflected in the numbers of continued benefits that were in the slides presented in December? Or do we anticipate a larger drop of covered patients after December due to error? The answer to that was it's in the it's going to be listed in the closures and not in the renewed data information, and the benefits ending data includes the scheduled closures for 12/31. Did I get that correct? Okay, great. And then the last question, I think, was Melody's question that we were addressing today that we're kind of still figuring out. But if it helps to know that we are tracking it, I see that Melody, you asked that question about the backlog in December. Still working on it. And then I see some things have come in the chat as well. Just catching up.
And this is Mel. From what I'm hearing that technically it's not a backlog. So I'm going to go forward with my for leadership that technically there's not a backlog. The 110,000 blah 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 is just an error in the spread and blah blah, just what you've said, and that you've got you've added eligibility workers, you got PH Tech, so you have a good support. 95 to 97% of the deadline have met the deadline. So I'm going to give them that picture. Because all they're looking at is we have a coverage on our a coverage plan listed on all of our legacy accounts that says pending Medicaid. And so they always are like, Mel, when are you going to turn that into Medicaid? so I just got to let them know that there's not a, 6-month, 9-month wait from the time that they see that particular accounts on the work on my report, and then when it turns into Medicaid or not. So they just kind of was basically coming with that caveat. Are we waiting, 6 months before we can see action on that pending Medicaid accounts, which, are in the millions when you, add up all of legacy wide, versus, so I think I've got what I believe will suffice and I'll go from there. Thank you.
And I just wanted to hop on that really quick to say, Melody, I know when your question was posed to, it was, well, two things. I think you were looking the first time for what's the turnaround after an app, how long does it take for an application to get touched, right? Was it an average of 15 days, 30 days, 12 days? Then we kind of posed that to ODHS, and they were really strapped to come up with an average that would feel encompassing of all of the possibilities, because if somebody just applies for medical, that's one thing. If they apply for medical and SNAP with a new person in their household, that's a different thing. If they're also applying for TANF, but then they're removing SNAP, or, there's just so many, I think it's a curse of possibilities that it's hard to really get it clean. I would love to just say, yeah, on average, 15 days is what to expect. We just don't have something that's that easy and anecdotal. Second, you asked me about overtime, and you can share that, yes, overtime is available to staff. And when they work overtime, they work applications only. And that is happening on the weekends as well. I don't know if I can say every weekend, but we get reports out regularly that they are allowing overtime. And when they do work it, they work the workload, not the calls.
Okay. Oh, that's helpful. That's even more helpful. Well, David, I've been at Legacy 44 years. I'm trying to put 5 more years in. So just keep in mind, you got 5 more years of me. I'm hoping I make your day.
Melody, I hope I have 45 more. You're never going to scare me away. Absolutely not.
Okay, you guys heard him say that.
Well, we love having you on this call, Melody. You really get the conversation going, so appreciate your input. So we're getting down to about a little under 10 minutes left in time, and I want to make sure everyone feels like they had their questions resolved. No one's leaving here with some confusion or some answers, some questions left unanswered. So I'm just going to give a minute for that. And then I did want to also offer a little bit of space for if anybody has any events or any resources they want to share here. I think that this is a really great space to share resources. There's a lot of people on this call today. There's a resource I wanted to share. Catherine, are you still on this call? She's still here.
I am.
Hey, yeah, I was talking to Catherine yesterday, and she told me about a resource through Kaiser Permanente that I didn't know about. So I'm going to let her share that for a moment. And then, while we're sharing, if you have any other concerns or questions that come up, please feel free to put it in the chat.
Yeah, thanks, Alex. Hi, everyone. Catherine Potter from Kaiser Permanente Community Health. And I know we have people probably from all different parts of the state here. So this is a resource. Unfortunately, it is limited somewhat geographically to the Kaiser Permanente service area, which is really the Portland metro area, the Salem, Marion, Polk County area, kind of along the I-5 corridor. And this resource that Alex mentioned is the Community Health Coverage Program. It is a fully subsidized health insurance program through Kaiser Permanente, and it essentially is for people that don't qualify for other forms of insurance, either private or public, including OHP. And it's a gold level marketplace plan. that has a full subsidy. So people actually don't pay anything for it. There are some limits in terms of numbers, but right now we still have space in the program. And we have enrollment partners that are yes, thank you. Project Access Now, Northwest Family Services, and Asian Health and Service Center. Those are the 3 community-based organizations that do all the enrollment for that program. So if you have people that are now over income for OHP and they live in the Portland metro area or Marion-Pope County areas, and they don't have any other access to health insurance, you might look into this. And best option is to refer people to Project Access Now. And thank you, Alex, for putting those links in the chat.
Does anyone else have any resources they wanted to share or events coming up? I know Project Access Now just had a enrollment event over the weekend. I'm not sure if they have any more coming up, but I'm keeping my eye on it, and if events do come up, I'll try to share it next month. So we have about 5 minutes. If anybody has any last concerns. Also, if you have any topic ideas of things that you are not seeing us address in these meetings and you would like to, you can either add it to the chat today, or if it comes up for you later, you can email me directly. I'm going to put my email in the chat. And then, yeah, we would just love to really tailor this to what people are needing right now. So putting this in the chat. Did that work? No. Why is it not working? There we go. All right. Yeah, Melody, we actually had them, we invited them to speak on one of our office hours, and I think maybe now that we have a bigger attendance, I might invite them back so more people can hear about all the cool work they're doing. Oh yeah, and then James offered, some specific suggestions. There's a smart sheet. Oh, also, if Cassie, if you're around and you want to share the slide with the feedback form on it, just so people know how to have all the different options for providing feedback. Cool.
To plug that feedback team, a lot of the feedback that y'all have been submitting to us over the last year has been what's building those changes that are coming in the April update to the system and whatnot. We are really listening to that and starting to see a lot more of that hit the road. Keep submitting it to us. Your pain makes positive improvements in the system for everyone down the road. So
How
we
does that
really
work?
appreciate all your ideas.
Is the feedback team like a committee? I don't actually know how that works.
I think we have Colin here if you want to introduce yourself, and
Yeah.
Courtney as well.
Hi, Jolene. Let them brag a little bit.
Oh, hi. I wasn't planning to go on, but hi, everyone. Jolene McGee, and happy to have Colin jump in too. And Courtney, she, her pronouns, manage the feedback team. We've been supporting public health unwinding for about a year now, and we just take any feedback from partners. We're internal, and we're really hoping to drive systems change. We really try to collect anything equity or access or systems issues and really elevate that to leadership. So, please do use us. We put the email in. We have a web form that's also, I don't know if you have the link to it, but yeah, thank you so much. I'm going to let Colin, if you wanted to say a quick hi, and Courtney, if you're there too.
Yeah, echo everything Jolene just said. I just started back on the team from the Ombuds team this week. So, but yes, short answer is feedback team is a group within OHA that tries to get all the feedback into one place to prioritize and resolve urgent and equity system related issues to ensure that everyone's able to get the care that they need.
Thank you. So I might let everybody go just a little bit early. I'm sure you probably have other meetings you got to get to and maybe need a bathroom break or something. So I think we're going to sign off now, but thank you so much for coming. We're going to have a meeting again on on the next second Tuesday of the month. So please keep your eyes peeled for that. If you have any suggestions for topics, we'd love to hear them. On that note, thank you, Deanna. I'm actually like talking to Deanna about maybe bringing in some of the conversations around the CPOP work group, seeing if we can get, some topics going that might be really beneficial to any of the assisters who are on this call. So thanks, everyone.
Thanks, Alex, for hosting.
Yeah.
Take care.
All right. Take care, everyone.